what sort of coffee junkie are you? How many coffees, how many teas do you drink every day? Now, everybody's individual, so I don't actually know what your intake's like or how that intake affects you, but I can tell you a few generalities. Coffee itself, everybody says, oh, you shouldn't drink it, it's bad for you. Really what they're talking about is the caffeine level. And for sure, you can have a normal cup of coffee, instant coffee, probably got something like 75 milligrams of caffeine in a cup. You go to a filter coffee, maybe 150 milligrams, well, it's actually substantially more. You go to one of your espresso places and you could have a 300 milligram hit of caffeine. So that's actually quite a lot. What does it do to you? The problem that I have with coffee is that it is a stimulant. Now, depending on your stress profile, one coffee might send you absolutely off the wall and make you jittery. You might actually be propped up by 2, 3, 4, 5, 6 coffees a day. They keep you going, yeah? The problem is, long term, as a stimulant, it's not good because it's wearing your adrenals out. Your adrenals, our stress glands that sit at the back of us, above our kidneys. So you have to keep those in good shape. If long term you want to continue being an effective leader, you've really got to make sure that your adrenals are in good shape. Coffee continually will stress them. So that's the important thing to remember. Now, coffee is great in many respects. It certainly is a quick pickup. We know that. It can help increase mental performance. It can help you deliver that report that you've had to burn the midnight oil for. You might have a long journey, a 4-hour journey ahead of you, and it keeps you awake. There's certainly really good sort of therapeutic times when it's useful to drink coffee. Coffee also, 1 or 2 cups a day has actually been shown to reduce, I believe, the incidence of liver cancer. So there's some protective aspects there, yeah? More than 2 cups of coffee a day has also been linked to increased risk of myocardial infarction, which is a heart attack in men. So, I think if I was going to say, yeah, if you like your coffee, I'd probably be saying 1 to 2 coffees a day. Okay. If you're a female leader, then maybe I'd be saying to you, if you have, say, some breast tenderness around that time of the month, certainly the methylxanthines in coffee, of which caffeine is one, can actually exacerbate these types of fibrocystic sort of breast disease type symptoms. Okay, so maybe coming up to that time of the month, you might like to take coffee out completely. Coffee is also quite good for eliciting a bowel action. So if you do have a touch of constipation, then a cup of coffee can actually be quite good at getting things going. Yeah? Tends to be more effective on an empty stomach, and it seems to be more effective for females. But hey, overall, I think I'm painting quite a good picture. Coffee as an adrenal stimulant, not so good, but it does have some beneficial sides. So, I'd like to think no more than 2 coffees a day. What could you drink instead? Loads of things. You could actually go on to herbal teas if you wanted to. Chamomile, which is nice and soothing. Peppermint, which is quite good. It's almost like an antispasmodic if you've got a touch of an IBS profile. What are the ones? If you want to cleanse yourself out, nettle tea. That's very, very cleansing. Doesn't taste too good, I have to say. Other coffee alternatives, cereal-based, Caro, barley cup. One of my favourites actually is dandelion root coffee. That's absolutely fabulous because it helps support your liver and your gallbladder, and it helps release the toxins in your body. So lots of good alternatives, for your coffee. You might even, to try and wean yourself off slightly, if you're a real junkie and have sort of 5, 6 a day, you might want to put in some decaf. Still got a few stimulants in, but it hasn't got the caffeine, so that's worth thinking about. And of course, water. Why not have more water?